I don't think that anybody can think about social policy in our country without thinking about FDR and the New Deal. It really is the turning point of the government providing charity, welfare, and social support to Americans. Early in our history, the Constitution really didn't mention specifics of what the federal government would do to support the American people or provide a safety net for those who are vulnerable. The idea is maybe perhaps encapsulated in the words to promote the general welfare. But other than that, constitutionally, there is no promise for a safety net or preservation of social justice or social welfare. It really fell to the responsibilities of states, local governments, and charities from about the 1700s to the late 1800s. Societal welfare was the primary responsibility of the lower levels of government, or churches, or private organizations. Unfortunately, these efforts were inconsistent and disproportionate across different areas of the United States. So, whereas you might have been able to find an orphanage run by a Catholic mission or a Catholic charity in Boston, you would be hard pressed to find the same thing in the backwoods of Louisiana. So, there wasn't a lot of you know, consistency in what you would expect America to have as far as protecting those who can't protect themselves. Now, of course, the progressive era, states were the laboratory for a lot of workers' rights programs, child labor, and educational programs. And eventually, what you see is the federal government taking some of the programs that were at the state and local level and adopting them nationwide, especially with progressive era reforms. I mean, progressive era is when the national government started to require compulsory or mandatory education. But really, it all hits a turning point at the New Deal. Okay. Um, the funny thing is, again, with states as laboratories, many programs that were a part of the New Deal were being implemented at the state level. Like most state governments had adopted a pension for older people to protect those people who retired and make sure that they had something. But, um, again, there were so many inconsistencies. So the New Deal just said, finally, we're just going to make uniform social welfare policy for all of Americans. Now, here are some images from the Great Depression. People would have to sell their kids in order, they couldn't feed them, so they have to get rid of them somehow. Here you have an example of Hoovervilles, where people became homeless because their homes were foreclosed on and they had to find somewhere to live because there was no shelters. Again, the Great Migration out of the Dust Bowl, you'll find iconic images such as those. Okay, so social policy, really the largest piece of social policy in the United States is Social Security. Social Security was set up with the Social Security Act of 1935. It was really set up to protect the most vulnerable people. It is a transfer payment. It is government money being transferred to the people. And whenever you have government money transferred to the people, you're going to have some controversy. Social Security's official name is Old Age Survivor Disability Insurance. So, Old Age Survivors and Disability Insurance. So, OASDI. When we think of Social Security, we automatically think of old people or retired people over the age of 65 who are collecting insurance or supplemental income, or maybe their only source of income after they retire. But other vulnerable people in this category include see, people who are blind, thanks to Helen Keller, she got that benefit apply for blind people, people who can no longer work, who have been injured and have been diagnosed by a doctor to not be able to do work, so therefore they are disabled. But if you think about it, we really think of Social Security as applying to older Americans because during the Great Depression, 50% or older Americans living in poverty exceeded 50%. Social Security tracks your earnings. That's why you have a Social Security number. So you track your earnings through your Social Security number. And originally, farm workers and government employees were exempt from having to pay for Social Security out of their paychecks. They just didn't have to buy into the program, but now everybody does. And then your employer also pays in money. Your employer pays for the unemployed aspect of the OASDI, and we'll get into that in a second. Now, the way that it works is that you pay into the system and everybody gets it back. I don't care how rich you are or how poor you are, it's distributive. They take it from you and then they give it back to you. Everybody from the poorest of the poor to Bill Gates. Now, if you look at this chart, you can see that this red line is the cost of benefits. This is going to be the cost of promised benefits. That continues to increase. However, this blue line is the revenue. The revenue, or what we are paying in from our payroll, is not going to increase. The number of old people collecting will increase, but the revenue will not. Which means that in about 2040, it should be bankrupt. We'll get to the problems in a second. In 1983, there were some amendments. One of the amendments raised the age from collection from 65 to 67. Also, politicians won't get rid of Social Security altogether, but one thing that they do is maybe lower the cost of living adjustments. The cost of living adjustment means that your Social Security can go up to account for inflation. And if you remember, inflation, an average inflation is about 2% a year. So about 2%, or your payout from Social Security will increase 2% every year, ideally. Again, you and your employer pay into the system. It also, through your payroll tax, and also the unemployment aspect of it is paid for and state controlled by your employer. In case you are fired or laid off, you get coverage for 26 weeks, but it can and has been extended by Congress for a lot longer. Okay, the future of social welfare or Social Security. It's going bankrupt. As I showed you in that last graph, the payouts will far exceed the revenue, partly because people are getting older and our population isn't growing at a rate quick enough to compensate for the people that are retiring. So more people are retiring, which means more people are collecting benefits. There are 75 million baby boomers that are going to start retiring this year. Social Security really began as a pay-as-you-go program. You pay into it, and the people who are on Social Security will get a payout. Cost of living adjustments make it even more difficult. Nobody gets rich off of Social Security. The average check for Social Security is $900 and an administrative fee to run the program. As the cost of living increases, so does the increased payment. That also bankrupts the system. So what some politicians have done to try to make Social Security more viable in the short term is to cut your cost of living adjustments. But that hurts the people who are currently collecting the benefit because they need that money to pay their bills. Like I said, nobody's getting rich off of this. Now, a couple of things that we could do. We could raise the taxes on the people who are currently paying into the system. If our costs are going to exceed our revenue, why don't we just generate more revenue so we can increase the contributions paid into the system? We can raise the age. You can begin receiving Social Security as early as 62 under certain circumstances, but we could raise it to 70. At this pace, payouts will exceed revenue still, but it would slow the pace of going bankrupt. Some Republicans, particularly Republicans, have said that we should privatize Social Security. Instead of paying into the fund, you would pay into a private account. The only problem is that if you tell me that I no longer have to pay into Social Security and I can start privately investing my money, who's going to pay for the people who are currently receiving Social Security? There is a Social Security savings account, but in no way, shape, or form is it large enough to cover the people being paid by the system if I and people my age stop paying taxes into the system and we start to privately invest our money. It's a hard pill to swallow. Um, and nobody really has a great solution. So you can either cut cost of living adjustments, that's short term. You could raise taxes, which nobody's really saying that's going to be beneficial. You can privatize it, which means young people like me would, and people like me and even younger would stop paying into the system, but that wouldn't cover the people who are currently collecting. And it's an ideological charged issue. Democrats would like to preserve Social Security at all cost. Republicans would like to privatize it. But nobody wants to get rid of Social Security because they're afraid of the people who back Social Security, old people. So Social Security and Medicare receive much more political and public support than welfare because they're backed by the most politically active group of people, seniors. So let me go back to recap. Go back a couple of slides. Social Security, the people who are currently working, like this young fella, pay for the people who are retired. We have less people working or paying into the system and an increase of the number of people who are actually getting a payout. You pay into Social Security through your payroll taxes. It's called FICA. And if they were to take or cut how much, excuse me, if they were to raise how much you paid in your taxes, that might keep the system from going bankrupt. If they raise the retirement age, that might keep the system from going bankrupt. And if they privatize, then we can end Social Security altogether. But the logistics of privatizing are almost impossible to figure out because who's going to cover the cost of the people who are currently collecting the benefits?